Hello, everybody. A very warm welcome to all of you. Well, since exams are approaching, and it is a high time for the student to start their preparation again for the theory examination. So, in order to address that, we have with us the university topper of PGI. So, please help me in welcoming Dr. Yuval. So, Dr. Yuval, over to you for this conversation.
First of all, I'd like to thank Mr. Ankit for going over and beyond and introducing me. But I want all of you who's listening to me today to see me as an MBBS student. I'm also right now a third year MBBS student, and I'm pursuing like community medicine and forensic medicine. So I'm going to just make this session short and let you all know what I'm going to tell you in this session. It starts basically with what is an MBBS university exam? What does it ask of us? Because it is clearly something that we think of almost the entire year. It is something that obviously makes it difficult for us to sleep, especially once it starts approaching. And secondly, how it somewhat differs from NEET PG, and yet how Marrow will help us in excelling both of them. Secondly, I'll be telling you about the syllabus for the exams, like basically where you can get the syllabus from, how is the basic structure of the MBBS exam. Then I'll let you know about what are the ways to attend the exams in general, irrespective of whichever year you are a part of, something that has worked for me. And at the end, I'm going to explain about the certain FAQs that a lot of you and a lot of students, my juniors and even my colleagues have asked me regarding the various topics that are to be covered. So I'll start with an introduction about what is an MBBS university exam. So we know we had school exams. It is pretty similar to that, like a board exam, wherein you have a practical exam and a theoretical exam. The theory exam usually is of 200 marks of all the three subjects that you go for the second year. And then there is a 100 marks practical exam that is to be done. Now, when I talk about the university exams, the university exam is divided into two papers. Like paper A, we have paper A and then we have paper B, each of 100 marks. And in paper A, you have two further sections, part 1 and part 2. And similarly, there is part 1 and part 2. Now, talking specifically of my university, that is PGIMS, there is a set pattern for all the four parts that is replicated in every single part that you see, which includes one case-based question, which is going to be a case study of 10 marks. So they're going to give you a case and they're going to be asking you certain relevant questions, which is somewhat very similar to the way we see it in NEET PG. You get those questions and then you ask the MCQs, but right now you have to answer the questions based on that particular case. Secondly, would be the long answer questions, which are of 5 marks each, and they're somewhat 5 questions. You have to answer for 5 marks each. Then there are short answer questions, which are going to be of 2 marks. That may be a give reason, that may be enumerate, maybe name something. That is going to be of 2 marks. And finally, you have 5 MCQs. And now this all sums up to 50 marks. And that is why the same paper is kind of replicated 4 times on different syllabus in the two papers. And it is same for all the three subjects. Now, talking about the syllabus division, you can get that syllabus division on internet. You just have to go for the NMC syllabus division class for MBBS phase 2 for all the three subjects, and they're going to show you the syllabus division, which is pretty much constant and uh, and pretty regular with all and consistent with all of the colleges that you're being a part of. So starting up with second is, what is it about the second prof MBBS exams? So now we have three subjects in MBBS second prof, and what really makes second prof somewhat easier than the first prof exams is that the three subjects that you have right now are pretty much related. Now, be it in the forms of pathology, wherein you're going to be talking about the diseases, or microbiology, wherein you're talking about the organisms that are going to be causing some of those infectious diseases. And third is the pharmacology, which is going to help you find out a cure for the disease, or at least give you some sort of rehabilitative care for the disease. So I want you all to, first of all, whenever you start preparing for an exam, I want you all to realize that you do not start preparing for an exam about 3 months before it. You start making the concepts for your subject right from the day one. And I think for me, like personally, I started using Marrow in the second year, and I started doing the very same thing from the very first day of my exam. So from the very first day of my year, sorry. So I started at least understanding what these subjects are. Like, what do they want? How is this helpful by the time I complete my MBBS? And why would it be important for me to learn this subject? And that would give you certain amount of insights of how you have to even answer the questions. Now, talking about the exam part of it, where you want to score the marks, we start preparing for scoring the marks like in the last 3 months, when we start to solidify what we have kind of understood over the past 1 year. So now talking about these exams, in the second prof exams, see, when we talk about pathology department, the pathology department here in PGIMS is, first of all, focuses on the specimens. They're going to show you the gross specimens. They're going to show you the microscopic slides. They're going to show you, and other than that, there is a museum. They're going to show you a lot of other specimens there. And mostly they're going to specifically talk about the morphology of the disease, the gross morphology, the microscopic morphology, and certain amount of pathogenesis. So basically, when we talk about pathology, every single disease that you study has to be given in four heads. One is the etiology. Second has to be its pathogenesis. Third, its clinical manifestations. And fourth is morphology, of which what I have seen is a lot of students lack on morphology, which perhaps is the main thing that pathologists do, right? Like the clinical manifestations would be with the clinical subjects, like medicine one would be able to know about this. We learn in depth about them in the medicine as well. But what is more important for us to know, which is, will help you fetch marks, is when you talk about the morphology. So whenever they ask you about the morphology of a disease, it is better you always learn it in two heads. You write about the gross morphology, you then write about the microscopic pictures. And remember, in pathology, they have a lot of names. They're going to give you like Reed Sternberg cells. They will want to know you about certain names of the cells that are very, very important, that are somewhat highlighted in every single book that you go for marrow. Every single time when you get taught by Khandelwal ma'am, you'll see that she highlights all of those topics. So you need to learn those because they will fetch you marks. Because that then the teachers would realize that you're not just learning it simply because of the sake of learning it. You have also understood the topic. You have seen those slides. You've seen those cells. Maybe draw a certain example or a diagram for that cell. That would also fetch you marks. Secondly, that was pretty much about pathology. In pathology, remember, it is very important to draw a histodiagram. Even if you're not drawing with like the classical histodiagram of anatomy, you at least draw a schematic diagram of certain cells. Like for a Reed Sternberg cell, you better draw a diagram. For a granuloma, you better draw a diagram. That is going to fetch you more marks. Secondly, for now, I shift on to another subject, which is microbiology. Now, again, about micro, they're going to teach you about the organisms. They're going to teach you about the lifestyle of the organisms, the life cycle of the organisms. They're going to tell you about the clinical features again of the diseases that are the infectious diseases. And then they're going to tell you about the laboratory diagnosis part. Now, you think about micro department, you would still realize that they're basically concerned with the lab diagnosis because that is what they're doing for the entire part of their life. So important is, while you may know certain clinical features that are pretty common to most of the diseases and maybe a particular symptom that is very common that again is highlighted in marrow, you need to go and highlight yourselves the laboratory diagnosis. And for the laboratory diagnosis, there's a very uniform idea that you have to write down. A very uniform format is there which you can consult either from the book, which you can supplement with marrow, like you learn from marrow, and then you can just open the book. Like in PGIMS, we have Apur Shastri as a book. You go, there are pink boxes given there. You can just look for the headings and you can divide it major organisms based on that. Secondly, any organism that is otherwise not very common and is still asked in the exam, you just maybe, you write whatever you know about it, maybe a word or two that is you have studied from marrow, because that is also appreciable for the teachers. Because remember, every single person who is there, who's checking the exam, who's on the other side, also knows the difficulty of the paper. So they would maybe not be as lenient when they're checking, for example, say cholera or Vibrio cholerae or maybe Salmonella typhi, but they would be very lenient if you're going for Zika virus, for example. So it is better that you know about marrow. Marrow is going to cover every single thing that you see. And secondly, you can just consult your books for the major headings that you would like to have, because then the teachers would think that you've not completely just been on marrow. So that's the way to be able to get good marks. Third, then I talk about pharmacology. Pharmacology is perhaps the simplest of all of the subjects, if you ask me, because that is like the most mathematical subject of all the three of them. Pharmacology is basically based on the classification of drugs, a basic idea of mechanism of action of each class of drug, and then knowing the names of some of the few drugs. That's more than sufficient for pharmacology. What is more important for pharmacology is how you present the exam, because they're very particular about that. And a lot of questions that the students have asked me is regarding this aspect. So I'll be covering it at the end when I tell about the FAQs. So this was basically about the three subjects that I wanted to talk about in the second Prof MBBS exams. Now I'm going to talk about, because now the exams are right around the corner, I'm just going to tell you about the mood that you should have right now. Remember, irrespective of how much you have studied, irrespective of how much you haven't studied, irrespective of whenever you have started preparing for the exam, this is something that my parents, who are also doctors who have done MBBS before, have told me, that nobody wants to fail you. Everybody wants you to succeed. Everybody wants you to pass your exams. So you stop thinking that you will fail. Because the teachers that are sitting on the other side, be it the internal, be it the external, does not come with the idea that you are going to fail. They are ready to pass you. Like, for example, if I talk about my batch, our batch, we had only about 10 children who were stopped, and most of them even passed in the supply exam. Not that you want to go for the supply exam, but the fact that there were like 240 students out of 250 who were passed, even when the exams were pretty tough for us. So makes you realize that the teachers also know what is important and how to go for it. So important for you is to start strong with the basics. Like for pathology, general pathology is something that is very important. You do not mess with general pathology. You do not mess with a disease like tuberculosis. You do not mess with a part of section like lungs, because they have been teaching you in pretty much depth. But for example, if you talk about some sort of Sertoli tumors or lytic tumors, and you are not able to answer them in depth, they're going to understand it because it's not that easy. Similarly, for pharmacology, if you're not able to tell the drugs for asthma, or you're not able to tell the drugs for, say, diabetes mellitus, then that will be a problem, because obviously that is a major disease that we are having in India. But if you're not able to tell a disease for somewhat, say, a disease that is already eradicated, or maybe a disease that is not very common, for example, yellow fever, it's not very common in India. So they're not going to say much about it. Similarly, it goes for microbiology. You need to know the major organisms. And for that to happen, it is important that you also pay attention to at least what the lecture is about, right? So you note down the lectures about, and then you start to learn those topics thoroughly, because they're going to be asked for longer questions. That is about the mood that you need to have, especially now that you have not prepared completely. You just go ahead and you salvage yourself with the major topics that are important. Thirdly, I want you all to know the how to attend the exams. Yes, attempting, a lot of people have this misconception that जितने ज़्यादा pages लिखोगे उतना ही better होगा. That is not the truth. Remember, even in while we were in school, our science teachers used to say, and now that we're in the science stream, they used to say that SST में लिखना होता है लंबे लंबे पोथे. In science, we don't want that pothe. We want the actual thing that you know. So I would say, instead of trying to go for long pages and long paragraphs, you first of all make your answers in points. For example, if somebody asks you about, say, granuloma, what do you mean by granuloma in pathology? So you start by explaining what granuloma is in about 2 or 3 lines. You highlight the important words that you want them to see. You draw a diagram first, and then you label the diagram on a complete page. And what all labeling that you have done, you explain that label. That is more than sufficient for the teachers, because they're also going through their running knowledge. They're not going to go and search Robbins. They're not going to go and search other books before they check your exams. They want the basic running knowledge that you have, and the more you're and the easier you're able to present it, the better marks you're going to get. So it's better you go for the flowcharts. You make your own flowcharts, maybe while reading. And especially, I'm telling you this, especially for Marrow, they're going to give you all of these things, right? They're going to highlight all of those things. Those highlighted words, when written and when highlighted in the paper, are going to fetch you 4 out of 5 marks. So for a 5 mark question, you don't have to go for 5 pages. You have to go for only maybe 2 pages, with one page completely of flowchart, the other page explaining those main points that you have studied about the topic, and that is pretty much done. And similarly, for the 2 mark question, go to the point. They don't want to hear anything. Maybe you're writing something else. Even if you don't know the answer, you write something about that topic. Do not write anything else, right? Because that irritates the examiners. So you better go and you just write down the points. If you know the answer, even if it is like a 2-line answer, you maybe write it in 2 points. You maybe write it, the reason for this is because, but you highlight those 2 points and you only write that, because any which ways our exam is very long. Fine. That is about how to attend the exam. For me, it was never about the length. It was more about the flowchart. It was more about the diagrams. And that is fresh marks. Last is certain FAQs. The most commonly asked FAQ that I have is how to attempt the question of pharmacotherapy. Like they ask you pharmacotherapy of glaucoma, pharmacotherapy of diabetes mellitus. So now, now in pharmacotherapy, it depends upon the time that you have, and that time will be directly proportional for the marks that you have for the question, right? They're going to give you maybe a 3-mark question as a part of a case study, maybe a 5-mark question as a complete long answer. It depends upon how much you have learned. See, learn the classification. As I said, pharma is all about classification, major drugs. So you learn the classification, you learn about every group of the drug, and you write down a basic mechanism of action of all of the drugs. If you have given this, they'll pass you in the exam. You don't have to learn the doses. That's not very important. But for example, say some emergencies like status asthmaticus, status epilepticus, or maybe, yes, these two are very important: status asthmaticus, status epilepticus, anaphylactic shock. So for them, they ask you and they want you to learn the doses along with the route of administration. So for that, you learn those 2 doses, you learn the route of administration, you write them in the right, correct prescription format that the department teaches you very nicely, and then you can explain about the drug if you know about it. Pharmacotherapy, otherwise, ideally, if it's a 3-mark question, you better write down about the drug, the dose, the route with which it is given. But it is very difficult. I know it's difficult to learn the doses. So you can at least write the name of the drugs. You can write their classification. You can write the basic mechanism of action and the rationale behind giving that particular drug. That would be more than sufficient to at least get you through that question. Yes, if you have additional information, maybe in the form of dose or in the form of route administration, you can always go ahead and write about it. Secondly, regarding pharmacology, morphology, the pathology and the morphology, go for gross and micro both. Whatever you know about it, draw a little diagram, maybe not a perfect diagram, but a little diagram about gross morphology. Give a little amount of pathogenesis if you want to, if you're not very sure about a morphology, just to give it a base and a platform to start with, and that is pretty much done for you. For micro, lab diagnosis is the key. Whenever you're going for cultures, if it's, for example, you're going for some culture that is of a particular color, you draw the diagram and you color it. That also gives an idea of the teacher to know that yes, you know the color of the diagram, right? So you know the color which it is going to show, which is again pretty much the very same thing that they do. So basically, I just want you all to know, I know the exams are right around the corner. I don't want you to headstrong most about this. Remember, you have learned things, you have prepared this. I have seen you all, especially the PGIMS students, I've seen them work hard for the past 3 months at least. Just know that they just know how to present those answers. That's pretty much about it. Learn now. It is not the time to get new information, it's the time to assimilate what you've already got, right? That may be in the form of pick up marrow, the topic that you think is good in marrow, the topic that you learn from Robbins, and you think maybe that's going to fetch me better marks, so maybe read it from Robbins as well, or you may go through marrow. But important is you know how you have to present it. That's pretty much about it. Do not take tension, and I tell you this irrespective of the fact that we all take tension. I take it too. I'm taking my tension because my exams come up in next 2 months, but it's pretty all right. You go ahead. It's going to be a great thing, a great paper moresoever, and you're going to pass. I know it. Just believe in yourself, and that's pretty much about it. It's nothing big. That's it.
Okay. So, Dr. Yuval, I have a question. Since we have mentioned, whatever the topics are there, important
Yes,
topics in the presentation and all. So let's say, since we have covered all the things what a student knows, right?
right.
Let's say if there comes a topic when the student doesn't know about it, right? How to, because see, there is always a saying that something is better than nothing, right? Let's say he doesn't know anything about it, that let's say, because since from the past 9 to 10 months students have been studying, right? तो कुछ ना कुछ तो पता ही होता है. So let's say अगर वो उसे टॉपिक पता है, how to exaggerate the things कि यार अगर 5 नंबर का क्वेश्चन आया तो 1 या 2 नंबर उसे मिल जाए.
So I'll start by telling you about my exams. मेरा paper में है Zika virus of 5 marks.
Okay.
And nobody in the room knew about Zika virus. मतलब आप ये सोचोगे कि the moment the paper was distributed और हम जैसे ही paper के through जाते हैं, I saw the 5 mark question and perhaps सारे room में एक साथ देखा तो we all gasped. तो आपको समझ आती ये क्या आया. तो पहली बात तो अगर उसके बारे में आपको कुछ नहीं पता, आपको पता है वायरस है, आप थोड़ा बहुत जितना आपको वायरस के बारे में पता है, बिकॉज व्हेन यू डोंट नो एनीथिंग अबाउट इट यू राइट अबाउट वायरस कि जीका वायरस है, तो वायरस हो सकता है सिंगल स्टैंडर्ड आरएनए का हो, डबल स्टैंडर्ड आरएनए का हो, यू राइट एनीथिंग अबाउट जनरल वायरोलॉजी जो आपको पता है, जो सेम है सारे वायरसेस के लिए. लाइक फॉर एग्जांपल आई रोट द लाइफ साइकिल ऑफ द वायरस. मुझे थोड़ा बहुत जीका वायरस के बारे में पता था कि इट इज लाइक पेरेंट टू चाइल्ड ट्रांसमिशन, तो लाइक 1 or 2 वर्ड्स दैट आई स्टडी, बट उसके अलावा मुझे बिल्कुल भी नहीं पता था. तो मैंने वो जो 3-4 पॉइंट्स मुझे जो पता थे उसके बारे में, by God's grace, like 3 or 4 points, I wrote them in big words. Then I explained a viral cycle, and then it was pretty much the question for me because I did not want to waste any time on this question because I have other questions to tell to. So that'll get you through. And secondly, once we went for the practical exams, even our PGs, the postgraduate students, they were saying that the paper was difficult. For the Zika virus, even if you have told about virus, maybe a little bit about virus, at least you have told that you've studied something regarding virus, they're going to give you marks because they know it's a very difficult topic to answer anyway. So it's better. That is why I ask you to start at least understanding the subject from marrow, because I had read it there. I had known something about it. Yeah, it is about parent to child transmission. I'd written something about that, and maybe that would have helped me get some perhaps 1 or 2 marks more and saved me from failing in that question. बट दैट इज प्रीटी मच इट. इट इज कम्प्लीटली नॉर्मल होना है. ये हमें डॉक्टर्स भी बोलते हैं, हमारे प्रोफेसर भी बोलते हैं कि कुछ ना कुछ तो ऐसा निकल कर आ ही जाएगा जो तुम्हें नहीं पता होगा. इट्स प्रीटी नॉर्मल. तुम्हें उसके बारे में जो भी कुछ पता चल रहा है वो लिख दो. तुम्हें उसके बारे में थोड़ा बहुत, जैसे कि अगर वायरस भी है तो वो लिख दो. तुम्हें एक लाइन नहीं पता तुम उसके बारे में लिख दो, बट दे ऑल्सो नो इट्स अ डिफिकल्ट क्वेश्चन. ओवरऑल अगर जो तुम्हारी मार्किंग्स हैं जितना 90% कवर करते हैं उससे 90% तुम्हारा पेपर ऑलरेडी पास होगा. दे आर नॉट गोइंग टू डिसाइड इट ऑन दिस. दैट इज व्हाई आई से कि केस स्टडीज भी जो होती हैं, आपकी फर्स्ट केस स्टडीज, उसको आप अच्छी तरीके से एक्सप्लेन करो, बिकॉज दैट विल फॉर्म द इंप्रेशन ऑफ द एग्जामिनर फॉर यू कि अगर आपने वो अच्छे से लिखा तो एग्जामिनर को पता है कि इस बच्चे ने पढ़ाई करी है, तो रिस्पेक्टिव ऑफ व्हाटएवर इट इज, ही इज गोइंग टू गिव यू मार्क्स.
ओके. सो वन लास्ट क्वेश्चन टू यू. अभी देखो, सिंस ग्रुप्स वगैरह सारे बने हुए इन चीजों के लिए, एंड बहुत सारे स्टूडेंट्स की क्वेरीज भी आती है कि थर्ड ईयर में मैरो लेना है, राइट? आपके हिसाब से व्हाट वाज द आइडियल टाइम कि स्टूडेंट्स को मैरो ले लेना चाहिए?
आई थिंक क्योंकि द बुक्स, like in first year I did not have anything. I started it in second year
Okay.
because मेरे seniors ने भी ये बोला कि जो books second year में हो जाती है वो थोड़ी सी extensive हो जाती है, KDT भी, then Robbins भी है, then we have Apoor Shastri, they're a bit extensive books, and जो हमारे number of hours हैं per subject वो कम हो जाते हैं, तो इसलिए हमारे पास इतना टाइम नहीं बचता, हमारे पास clinical posting start हो जाती है, तो you want something that is giving you that knowledge, explaining you at the same time, मतलब आपको वो book का crux दे रहे हो, and at the same time आप उसको revise करते हो, मतलब you can read certain topics. So for me it was the beginning of second year I started with Marrow, because उसमें क्या था, उसमें I would at least see the videos, I would understand the topic, and तो जो मुझे लगता था कि हाँ maybe something that is more important जो हमारे स्कूल कॉलेज वालों ने स्ट्रेस करा है, वो मैं थोड़ा बहुत रॉबिन से भी देख लेता था, बट मेजरली इट वाज मैरो, एंड एज आई से मैरो की वजह से मेरा वो जीका वायरस ठीक हुआ,
Okay.
जो
And
थोड़ा बहुत जितना बचा है, सो इसलिए आई वुड से यू गो विद सेकंड ईयर सब्जेक्ट, बिकॉज़ सेकंड ईयर सब्जेक्ट्स अ बिट डिफिकल्ट, थोड़ा सा डिफिकल्ट होते हैं, रिटेन करने में थोड़ा सा प्रॉब्लम आती है, तो उसमें दे विल गिव यू विद दोस निमोनिक्स आल्सो, तो दैट इज अ गुड थिंग।
okay. And जिसने अगर सेकंड ईयर में नहीं लिया फिर?
तो फिर थर्ड ईयर तो डेफिनेटली ले लो।
Okay. तो
थर्ड ईयर तो मतलब थर्ड आई रिमेंबर थर्ड ईयर में तो हमारे कॉलेज में ऐसी वेव आई है, मतलब सेकंड ईयर में इट वाज लाइक मे बी 10-20, नाउ इट्स 200 10-20,
okay, okay.
and जो नहीं ले रहे हैं they are hopefully waiting for a new edition so that they're able to finally buy it. So but year is a great year, अभी मेरा चल रहा है, and now they stress upon clinical classes, so we have teachers like Rohit Khandelwal sir, we have medicine के लिए we have Rakesh Nair sir, we have all the teachers who are available, and they're trust me teaching brilliantly, so you'll just go ahead, you watch the Marrow videos. I'm actually going to watch after this as well for Okta.
Okay.
So you go with Marrow after third year, that is what I say, at
Okay.
least, like you're
Well, thank you so much, Yuval, for sharing
no,
your valuable time. Thank you so much.
thank you.